Floaters are most commonly caused by a posterior vitreous detachment, or PVD. To help understand what this is, it's helpful to know the basic anatomy of the eye. At the front of the eye, there's a clear covering known as the cornea, shown here. Immediately behind there's a pigmented structure called the iris. And finally comes the lens of the eye. Behind that, the majority of the space of the eye is filled with a gel-like material called the vitreous. The posterior surface of the eye is lined with the retina, and finally the optic nerve, which takes the vision back to the brain. When the gel pulls forward off of the back surface of the eye, two things happen. A dark ring can form where the vitreous pulls off at the optic nerve, creating the floater. Also, a tear can develop in the retina, which is shown at the bottom of this figure. These tears can lead to retinal detachments, which is why it's so important to have an eye exam as soon as possible if you notice floaters or flashing lights. The floaters can often be seen in the vision moving as the eye moves, and there's a few things to remember. One, the vitreous does not need to reattach, and the floaters will fade over time as the brain adjusts. If you see any flashing lights, a veil over your vision, or an increase in floaters, these can be a sign of a retinal detachment. It's important to call the office immediately if these occur.